Hello, everybody. It's time for another Chuck Chat. It's December the 16th. I'm going to share my screen here. All right. Always like to start off with a little humor. This prevents measles, and this prevents goofy conspiracy theories. COVID-19 in Westminster, since March the 9th, we've had 20 resident cases, 2 deaths amongst our residents, 18 have recovered. Amongst our associates, we've had 26 cases total. Most have recovered. There are 2 that tested positive that are recovering at home with no symptoms. Total tested, including resident staff and private caregivers, 3,110, so 3,110. Our infection rate is 1.5%. This is the COVID tracker results for the state of Texas daily. You can see that we're still in excess of 10,000 cases per day in the state of Texas. And you can see that Texas has exceeded 1.3 million, and we're actually passing California at this point. So not good news. Independent living visitation is still restricted. Scheduled visits with reception only. Visits may take place in designated locations only. Visits are limited to 2 persons for 1 hour. Social distancing and masks must be worn. No eating or drinking with visitors. Associates will address residents and visitors that are not following the protocol. Visiting hours continue to be restricted 8 a.m. to 4 p.m. We are still in phase 2. We have not changed that. We're still doing very well, and I appreciate everybody's cooperation. That means that we can have 20 or less in activities that are staff or resident led. Some limited indoor activities, larger, up to 30 in Harrisville Hall with sign-up sheets, social distancing, and mask. Up to 50 for outdoor activities with social distancing and mask. The Laurel dining room capacity was reduced to 25% through this stage 4 that the county, Travis County, is in currently. That means about 30 people can sit in the Laurel at one time. Visitation is increased as available up to 2 visitors per visit. Again, 1 hour, designated locations by appointment only, 8 a.m. to 4 p.m. And then some limited service providers are allowed in independent living with a schedule no more than twice per month through the resident services office. Healthcare center visitation and assisted living visitation is still restricted because of the positive cases that we've had. We have to be clear for 14 days until the visiting restrictions can be lifted. So at this time, only essential caregivers. Please do wear your mask like London in the top picture, like this. Please wear your mask like this. If you need a mask, please ask reception. December 16th, questions. Why isn't there an app for associates that associates could use on their phone to answer the daily questions for sign in when they come to work? This service is not currently available through our provider, though they say that they are developing it. The sign-in sheets require a signature for associates, and we are required to retain those sign-in sheets for Department of Health and Senior Services. Our process is working. We ask that the associates sanitize their hands before touching the pen, and then personal protective equipment is also worn when they're signing in. Last question, and I've had this actually several times asked, but it's all been the same. This is, I only received these 2 questions. When will the vaccine be available at Westminster? Do we sign up for vaccines or just walk in? What priorities are being applied? So I have several slides about the vaccine. 2 vaccines are submitted, have been submitted for FDA approval, Pfizer and Moderna. Pfizer was approved on December the 10th, and Moderna is scheduled or expected to be approved tomorrow. Likely the first available vaccination date will be on or about December 21st and December 28th, respectively. Actually, they started giving the vaccine in Austin at the hospital Dell, I believe, yesterday. So it has begun. Both vaccines require 2 doses, either 21 days apart or 28 days apart. So if we get the Pfizer vaccine, it'll be 21 days. If we get the Moderna vaccine, it'll be 28 days. Brands are not interchangeable, so skilled nursing residents and employees and related personnel will be the first priority. Also, assisted living will be priority here because it's under the same roof. There's estimated available initial doses will be 40 million. So 20 million individuals across the country will have access to the vaccine initially. Healthcare personnel total 21 million, and skilled nursing and assisted living and other residential care residents total about 3 million. So you can see that it's pretty limited in this first phase, 1A. States will be driving the distribution and administration through CVS and Walgreens initially, or other determined process. Again, we are signed up to be partners with CVS. Important, LCS nor Westminster has any control over the dates, process, distribution, or administration of the COVID-19 vaccine. The Health Services Department and senior leadership at LCS will be providing overall strategies and tools. Each state will be in control of their own distribution plan. Follow closely your specific state's directions. Again, CVS will be distributing and administering and reporting for the vaccine. Westminster is responsible for coordination of their specific plan under the direction of the state. The pharmacy we have selected are each community will be given 3 specific dates, and I've talked about that before. Each community will need to complete a series of tasks in preparation for the administration dates. Mostly that is setting up a clinic and paperwork that's involved. We have to get consent signed, and we also have to get copies of insurance cards submitted. Health centers and health center employees will be the priority, but all related healthcare personnel can receive the vaccine. This includes all ancillary departments, contractors, volunteers, etc. We understand that others may be able to receive the vaccine during the clinic times as long as they are included in the rosters. So we are trying to include all independent living in the rosters to hopefully get vaccines for everybody, but there are no promises yet. It is important to obtain information about the vaccine from reliable sources, the CDC, AMDA, CMS, HHS, and I've included a couple links here. If you'd like these links emailed to you, just reach out to reception, but you can go yourself to the CDC's primary website and find this information for yourself. Just some facts that you need to know. COVID-19 vaccines will not give you COVID-19. COVID-19 vaccines will not cause you to test positive for COVID-19. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. Getting vaccinated can help prevent getting sick with COVID-19. Receiving the mRNA vaccine will not alter your DNA. So there's a lot of rumors out there. Let's talk about COVID-19 vaccine and its safety. Only safe and effective COVID-19 vaccines that have been rigorously tested in large, well-designed studies with tens of thousands of volunteers will be available. COVID-19 vaccines are following the same rigorous multi-phase testing process as every other vaccine does. COVID-19 vaccine development is moving faster than normal because our top medical experts have made it their highest priority, not because steps in the testing process have been skipped. The FDA will share information about authorized or approved COVID-19 vaccines so you can see the scientific evidence for yourself. COVID-19 vaccine developers are trying to make sure their clinical trials reflect the nation's diversity because these vaccines must be proven safe and effective for everyone. Medical experts and career public health officials, not politicians or their appointees, will decide when a COVID-19 vaccine is safe, effective, and ready for public use. Side effects for any vaccine usually occur within 45 days of the injection. What we need to do now, what we're working on, we are providing primary, secondary, and third party point of contacts for everyone. We're completing consent forms for all residents and staff who will be vaccinated as soon as they arrive. We're going to make copies. Actually, we're already making copies of all insurance cards in advance and maintaining them for each individual. We will have completed consents and insurance cards ready when the vaccine is ready for our distribution. And we will retain any paperwork as a medical record. We're preparing for the clinic visits. So in skilled nursing, our healthcare center, and other non-ambulatory residents, they'll be vaccinated door to door. Others, we will use a central location like Harrisville Hall or an activities room around the campus to provide the clinic. We will assign community personnel to assist. I strongly encourage all community staff to participate in the COVID vaccination program. I will be taking the vaccination myself as soon as available. The medical community has deemed the vaccine safe and highly effective as a protection against COVID-19. We have been empowered to care for the most vulnerable class of citizens in the U.S. Let's do our part to protect them by getting vaccinated. We strongly encourage all residents to participate in the COVID-19 vaccination program. This is the generation that has seen the eradication of polio, rubella, measles, whooping cough, and fought in World War. You know how to lead by example, and we need you to do it again. Residents are the most vulnerable population, so please take the vaccine. Continue to wear your PPE, social distance, and exercise infection controls, meaning hand washing, sanitizing. Continue to self-isolate as we have identified previously. We continue to exercise the 14-day isolation standards, and we can all do our part. So roll up your sleeve and get vaccinated. Again, we're registered with CVS Omnicare as a partner. We will schedule with CVS and coordinate 3 on-site clinics directly. Order vaccines and associated supplies will be done by CVS. They will ensure the cold chain management for the vaccine. They will also administer the vaccine. They will report all the vaccination data, and they will adhere to CMS requirements. And this is information on the phasing, and you can see this is the jumpstart phase, phase 1A. So high-risk healthcare workers, first responders were included in that. And they're also including skilled nursing and assisted living. And then phase 1B, which should follow shortly thereafter, should be in the next following 30 days that we roll out another round. But older adults living in congregate settings. So that's CCRCs, large settings where there's many seniors. And you can see the various other phases. I won't go through those today. Again, I think you saw this slide last time, but just an idea of what the clinic will do. So dose 1 for everyone in the community that needs the vaccine is able to get it. And then they'll follow up with a second clinic, which will be based on which vaccine we get. So if we get the Pfizer vaccine, it'll be 21 days. If the Moderna vaccine, it's 28 days from that first clinic. Again, Westminster nor LCS has any control over who gets the vaccine. Healthcare workers, residents of assisted living, and skilled nursing will be included in this first rollout, phase 1A. Senior living leaders, including myself, are advocating for early access for all residents in our communities, regardless of level of care. Just understand that only 40 million doses are coming out in this first wave, and there are 20 million folks that'll be vaccinated, and there's more than 21 million healthcare workers. There's 3 million residents of skilled nursing and assisted living. So senior living leaders are advocating as well as I am to try and get the vaccine for independent living. We understand the vaccines to be safe, even though they were developed more quickly than others. The vaccine has been tested on tens of thousands of people, just like the flu vaccine is. I am sending letters out, which you should have received earlier in the week from me and also from the medical director of our community, Dr. Liam Fry. Please contact the health services office if you're interested in taking the vaccine, and you can do that through the reception desk. And you call any reception desk and they can get you through to Robin Akins in the health services office and let her know if you want to take the vaccine or if you don't, and she can help you talk through that. I encourage everybody to take the vaccine. All right, enough about COVID. Construction update. We're still making progress, lots of progress. This is the Windsor infill tower location. You can see that we are almost completely excavated. And there's a lot of work going on in the Windsor Courtyard. The construction update on the Carlisle building, you can see that almost all of the hole has been dug and excavated. They are just removing the final piles of dirt and gravel out of there. So they're really making progress. This is as deep as it has to go. So you'll start seeing some concrete in the very near future. Bridge number 2, work is ongoing with the completion approximately the end of January. Bridge number 2 is located behind the bistro kitchen and will connect the Preston to the pool area, as well as the other amenities. Electrical work inside Windsor level 3 and 4 hallways is ongoing with completion approximately 12/23/20. The tower crane is to be constructed beginning this Friday, December the 18th around noon. And it'll start with a placement of a smaller crane in the north drive. So the north entrance will be closed while they put together a crane to erect the tower crane, which will start on Saturday. The Windsor Courtyard work continues, again, ahead of schedule. That is planned to be complete by May, hopefully a little sooner. We'll let you know, but it's going very well, very quickly. This is just a construction look ahead, just to let you know what activities are going on. I'll leave this on the screen for a little while, but you can see that there is a lot going on. The tower crane, again, is going to be erected over the weekend. They will close down half of Bull Creek to allow this to happen. You should have received a memo about the tower crane. If you have any questions or if you did not receive the memo, please reach out to reception. Stay away from the north drive. We will open the drive in between the buildings for the weekend so that Preston traffic can go out the visitor driveway between the two buildings. Waterproofing is being installed on the Windsor infill areas in preparation for the construction. So the concrete in that area will start to come out of the ground over the next several weeks. Waterproofing also, the courtyard improvements and the drains in that area are being installed. They're going to pour flat work and prepare for the bocce ball court coming soon. And then various other projects, but you can see that there's a lot of work going on. Again, this is what the overall site plan is. The bridge that I'm referring to is this bridge along here. And I'm getting a lot of questions about the Windsor Courtyard, so I'm going to try to talk about that just a little bit. You can see here a picture of the rendering of the Windsor Courtyard. This is the bocce ball area, maybe used for other things as well. Outdoor cooking areas here. Some small trees will be placed. It'll be very attractive when it's all said and done. I know you can't see it right now if you're looking out there. And then this is a water feature that's being installed that will provide a little bit of a separation between this therapy exercise equipment and the rest. And also some outdoor dining will be outside of the bistro area along this But that cinder block wall is the start of this water feature that will be installed. And you know that if you've been paying attention to the Windsor Courtyard at all, we've had issues with the water fountain that was located over here in this area. So this is a water feature to replace that. Also, there's a little bit of a fire pit area here that'll be very safe but easy to use. And again, the outdoor cooking area. It's going to be very attractive, very nice when it's all said and done. I know that right now it's difficult to see the end result. Just to give you an idea of what we're looking at when it's finished, here's an aerial view of the plan. So most of this area stays the same. We are adding a fireplace and a small storage closet here at this location to put some outdoor furniture and equipment. You can see the trees. Unfortunately, we had to take down 3 trees because the arborist said they could not be transplanted, they could not be repurposed. But those trees will be replaced. There will be some beautiful trees along this area and one placed here. The water feature is here. There's a sitting area with some, again, a fire feature here. There is an outdoor cooking area here. And then again, that bocce ball court is located right here, and the outside dining is located here. Give us some time to complete it. You will like it when it's finished. We have completed 18 of the apartments in the Windsor Tower. The charter members have made their selections on their aesthetics. And then 42 Carlisle charter members have completed their first appointments and 14 have finalized so far. So they've made their selections and paid for their customizations. And we have approximately 90 priority members waiting on apartments. Building and grounds, just report on our various projects around the community. Preston interior window work is completed on 224 apartments. The solar film is underway. Approximately 12 have been completed and 46 to go. Should be finished by the end of January, maybe mid-January. Preston flooring replacement, lobby and dining room has been completed. The 2nd, 3rd, and 4th and 5th floors are mostly completed. You will notice that some of the old carpet is still in place. We are having some issues with the vinyl tile that was selected. We used it in the lobby and it did not work well. It looked really bad. It came up and was uneven in some places. So we have identified another product that should work better, and it will be installed soon. Once we see that that works well, we'll have it installed on all the other floors. The high traffic areas around the core elevators we're using a luxury vinyl tile for. Preston HVAC update. The cooling tower was replaced. The chiller has been completed. That was replaced, and we will be testing it soon. It's been too cold, so we haven't had to use it. We've been using our smaller chiller. And so we'll test the large one soon, but it is complete. 4th floor laundry room is to be enlarged, and that project demolition just started this week. We're also doing various hot water upgrades around the campus to try and improve the hot water coming into everyone's apartments. We're installing some control equipment that should make this much more efficient and speed up the ability to get hot water and also maintain it at the safest possible temperatures. We're also working on a water softening program for the entire campus, and we'll be installing that over the next couple months. Just some reminders: always wear your mask when outside of your apartment. Maintain 6 feet of social distancing at all times. Do not touch your face, eyes, or your mask. Wash your hands often and practice good hand hygiene. Limit gatherings and meals with others. Limit leaving Westminster to essential trips only. Limit contact with individuals from outside Westminster. Limit visiting restaurants, bars, outside salons, etc. Limit holiday visits with family to small gatherings. When visits occur, please make sure that you limit the numbers to 5 or less. Limit time for visits to no more than a couple of hours. Limit your travel and overnight stays. Please also, there's been some issues with candles lately and stoves being left on. Please do not use lit candles in your apartments. I would much rather you use warming devices, candle warmers. They work much better and they're much safer. Please do not leave your stove on in your apartment. That can start a fire. Please don't store paperwork or files in your ovens. Again, candle warmers are recommended in lieu of lit candles. Lit candles can be very dangerous, and we almost had an incident recently where candles started a fire. So please be careful. And roll up your sleeve and get the vaccine. One last word. I want you to know that, this vaccine is not the miracle, right? It's not going to stop our use of personal protective equipment. It's not going to push us to reopen faster. We are going to be cautious still. We're still going to maintain the precautions that we have in place. We're still going to use PPE. But this vaccine is the beginning of the end. So please be patient. We will get the vaccine to you as quickly as we can. Happy holidays to all of you. I wish you all the best. Please stay safe and healthy. And I hope you all have the happiest of New Year's. Thank you much.